Hello and welcome to Advanced Pharmacology. I'm Dr. Brandon Faulkner. I have my Doctor of Nursing practice in acute care. I'm a nurse practitioner as a hospitalist. I practice 5 days a week, and I'll be teaching this class this semester. Um, and this is the first time I've ever recorded videos like this, so I look like I'm staring at something else because I can't look directly at the camera because that's weirding me out. Anyways, I'm coming to you from my office at my home. Um, this video is to give you an introduction to the course and to um, go over some of the things that I'll expect, things to calm your nerves, and and then discuss the first bit of course content, which is covered over this weekend. And there is an exam that opens on Saturday through Tuesday, I believe. Don't freak out. It it will be easy. This will help you start off with a good grade to boost your confidence, and all you have to do is keep that good grade. Um, First of all, this is the book that you need. I believe that was already posted on Blackboard. This has not changed. So far, we'll keep this book. I kind of like it. We'll just see how it goes for the rest of the semester. And I want your input on what you think of the book, whether it's conducive to your learning. Um, all of my test questions will come from the book. I won't mess around and throw you some curveball from something that I've learned in my experiences and practices. It will come from the book. The board examination for which you will be testing is similar to the NCLEX in terms of it assumes that life is perfect, that as a nurse practitioner, you have all the resources you need. Your hospital or your clinic has every staff member possible, every resource available, every bit of money you should have, and things are to be done in a perfect way in a perfect world. That's how we will proceed in this class according to the book. Now, um, if you have questions about, well, this is what the book says, but this is what I've seen, feel free to email me and I'll tell you my personal thoughts about that. But for the purpose of test taking, things will be exactly as they're stated in the book. Now, um, each chapter I will discuss with you. I said with you, I meant with you. Um, I'm looking at the book right now. One thing I do like is there are lots of bullet points and tables for things that are basically summarizations of highlights and important things. I'll probably tell you which of those to really be paying attention to, and I may also point out which sections in the chapter are more important than others. It's all important, but some of it is more historical information that you can read at your own leisure because you have nothing else going on this semester, right? No. Also, at the end of each chapter, there are questions. Now, I don't expect you to fill those out, but give them a good glancing over because they're good test questions. Some of them are quite simple to the point, just so that you can express that you've understood a concept. And that being said, that will be the main foundation of this course is concepts, not to make you an expert prescriber. Okay, before I get off on that, um, other test questions may come from this. This is the study guide by Barkley for your board's examination. I'll probably select some questions from there every now and then. Now, if you don't have that study guide, don't worry. Um, if I think I'm going to use a question from that, I may post that material on Blackboard so you'll have it there, which hint, hint, if you see it posted, read it. Okay, now, what do I want you to get out of this course? First of all, prescribing medications, pharmacology is a huge, broad concept. There's not a nurse practitioner, physician out there who can tell you all about it, even those who teach it every day, which is not me. Um, what I care about is that you have a good understanding of principles and foundation. You'll learn how to prescribe medicine in your clinicals and in your practice. People will teach you that. It's something you'll continue to learn in your practice. The foundations are what are important. For example, antibiotics. Well, take the fluoroquinolones, for example. There are all kinds of medications in that class: Levaquin, levofloxacin, ciprofloxacin, moxifloxacin, oxafloxacin, all kinds of things. Well, what's the difference? Well, they basically work the same way, and many treat the same types of infections or kill the certain types of antibiotics, but some of them have different properties which make them uniquely tailored for certain circumstances. So, what I care about is that you recognize that this disease or this situation may require this class of medication more so than the particular medication itself. Now, um, if you don't feel challenged enough by that, please let me know. We'll work on that. What I don't want to do is make the class so damn difficult that you're so caught up in each individual drug and what's going on that you fail to grasp the concept of how to treat, how to select a medication. And that's far more important, I think, at this point than it is to getting crazy. And I'm not going to, if there's a new drug out on the market, I'm not going to ask you about it. I have pharmacy representatives coming to my office every day about new drugs, and I can't tell you what half of them are or what they do, but I do eat their lunch. Okay, now, I know this is a long, drawn-out video, but I want to get everything covered. The course itself, 8 quizzes. Quizzes are simply exams with a different name to make you stress out less. They're not going to be huge. If you have 50 questions on a quiz, that will be gigantic. So somewhere between 20 to 50 questions. Sorry, I just had to fix my mustache because I can see myself on the computer. Anyways, those will each be worth 10% of the grade. So 8 times 10 is 80%. That was easy. There will be 4 discussion board participations. Now, those are not things where you have to be live. These will be opened up probably on weekends. Whenever I do post them, they'll be open for several days. And basically what I will do is I will post a scenario or situation or posit a question, and then I want you to answer it. 4.5% of a discussion board is participation. The other half of a percent is, did you spend half a second putting an effort into it? So those will be easy points. The point again there is not to make this class so easy that you don't know anything, but to help exercise your brain. Now, for those at 5% equals 20%, plus your quizzes is 100% of the course. I also plan to offer 3 bonus point opportunities throughout the semester. I don't know what they are or when they will be. Each one will be worth 2% for a total of, 6% that I will add to your final grade. So if you find yourself in a bind, make sure you've done those. That could help you. But I will say this, when they're offered, do them, because they'll only be offered for a short amount of time. You can't just do them at the end of the semester and be caught up. Okay. So, quizzes every 2 weeks, covering the course content from the previous 2 weeks. The, oh shoot, I forgot what I was trying to tell you. The quizzes will be open probably on a Friday or Saturday, and I'll leave them open through Sunday or Monday. It'll be on the syllabus. I want you to have plenty of time to take it. I plan to give a generous amount of time to take it. Nothing crazy, no 5 hours or anything like that, but you'll definitely have more than 30 minutes. Don't stress out. There's a lot of information to learn. Some of the sections are going to be very difficult. For example, cardiology, pulmonology, hemodynamics, blood pressure, and hyperlipidemia are all in a 2-week module because I've tried to group things together that tend to go together. Well, those also happen to be some of the more difficult issues in pharmacology to work with. So those times you're going to need to pay more attention. Those times will be very important to pay attention to my video lectures, which, by the way, are optional, but they may have very good information. For example, what you really need to pay attention to for the test. And then again, the discussion boards, they'll be open for a couple of days, and we'll worry about bonus points when we get to it. There will be no scheduled meetings where you're required to log on for face-to-face. There will be no on-campus meetings. I don't want you to have to take off any further time for this course. I know that you'll be doing plenty working, clinicals, other courses, so don't worry about any extra time for this. Just make sure that you have some time during the time that the test is open that you can take it. There will be no final examination. I don't think that will serve us any purpose. By the end of the course, I may have an activity so you can write me a prescription just to make sure you can do it. It's easy. It's stupid, but I remember the first time I wrote a prescription, I was like, am I doing this right? So we'll do that just for the sake of saying we've done it. All right. I think that wraps it up for the introduction to the course. We're still working out some stuff with me being a new professor, so I still only have my personal email, which is on the syllabus. Please feel free to write me at that. Also, I've posted my cell phone number. That's the best way to get a hold of me. If you want to text, that's fine. If you want to call me, that's fine. Like I said, I do practice 5 days a week. If I don't answer, I may be in the middle of a procedure or seeing a patient or something like that. I will call you back. Just leave me a message or simply just text me. I'll always respond to that. I try to go to bed between 9 and 10 o'clock. So if you have a late night question, feel free to call. But if you call after 10 and I don't answer, I probably won't because I'm a hard sleeper. Okay. If you have any questions regarding what to expect from the course, if there's something that you feel that I may have left out, please email me and say, hey, what about this? And I will email you back and say, hey, it's this. All right. And that's the end of this video. The next one will be about the course content for the first exam.